It is Wednesday, July 7th. I'm Jessica Lovell. Thank you for joining us on day 2 of the Morning Medical Update. All week we are talking about COVID-19 weight gain, and research shows that many people packed on the pounds, on an average of 1.5 pounds per month since the pandemic began. So coming up today, our guests are going to help to inspire us and help us to make better choices. We are so glad to have pastor and patient Brian Mann. He has a compelling story he is going to share with us. So we'll check in with him here in just a moment. We also have dietitian Tara Marcello. She is going to get us back on track in the kitchen.
Fingers crossed.
I know, that's a lot on your shoulders today. So it should kind of help us think outside the box when it comes to our nutrition and getting back on track. Okay, so first, before all that, a quick 4th of July injury update. We had a total of 22 patients since Friday from firework injuries. Here is the breakdown. 15 men, 7 women with injuries. They were ranging in ages of 10 months old to 75 years old. 10 people were admitted to the hospital, and the most common injuries were to the foot, face, and hands. Those were from homemade fireworks, sparklers, mortars, and smoke bombs. So before we get going today, of course, Dr. Dana Hawkinson is going to join us with our COVID count. Good morning to you.
Hi, how are you?
How are you?
I'm good. You know, our numbers are staying somewhat steady in that high teens to low 20s. We've gone down a little bit. We have 18 active infections, 6 in the ICU, but luckily none on the ventilator. We still have 12 additional patients that are in that recovery period, so a total of 30 at this point in time. Hays has 2 active infections as well.
All right, so before we get our conversation started, do we have any recorder questions on the line today?
Sure, good morning. Cody Holyoke with Channel 9. How are you?
Hi, Cody.
Hey.
Hey, this is a question for Dr. Hawk. As we talk about Delta cases coming up and starting to surge in our area and even farther south, especially in Missouri, is the health system taking any of these extra cases from some of these hot spots? If not, are you preparing? And what are the major challenges for you right now?
Yeah, you know, we always, and we have been taking transfers for years. I mean, that's just what we do. Being a big academic medical center, we do have areas that transfer to us, certain areas in Missouri and Kansas when they reach capacity, or there's issues that they cannot treat reliably there. They send it here for upgrade and care. Are we taking COVID patients? We certainly get calls for COVID patients. I know that we have taken a couple, but again, we've also taken transfers from those areas, especially Springfield, for other medical reasons that they weren't able to really care for because of their capacity issues due to COVID and their beds being taken up by COVID. We are ready. We are always prepared for surges and increase in cases. Hopefully that will not happen from patients around the metro area, but we are happy to take areas, rural areas that maybe have lost their capacity due to COVID, but we are always ready for increase in our COVID numbers. We have good PPE stores and supplies right now. We have good vital drugs stores and supplies. Ventilators, we have all of that. We have the hospital beds right now. But we should state also that our hospital, our health system, is quite busy and full with just routine, if you will, routine medical issues, heart attack, stroke, surgeries, other things like that. So, but we are always prepared and will be ready should we need to take more COVID patients on.
With that surge, just a quick follow-up, with that surge, that has to put a strain, I would imagine, on hospital beds with more people coming in for usual issues.
Yeah, it absolutely does. You know, we are constantly 24 hours a day monitoring our hospital beds, monitoring our capacity for people coming in, admitted, surgeries, all of that stuff. So it is a very, there's a lot of details and variables in that and what we can accept, how many patients we can accept. But right now, our hospital has been fairly full, again, just with other general medical issues that need tending to rather than COVID. So overall, yes, we have to continue to monitor our bed capacity and status. And, you know, certainly if we need to take people transfers to help save their life and make their life better and get them better, we will certainly do that.
Any other questions on the line? Jill, do you have anything?
We don't have any back here, so I think we are good to go.
All right, so Dr. Hawkinson,
All right.
don't go anywhere. We'll have
Be
community questions for you here in just a moment. So I'm really excited to talk to our guest today. But tomorrow, please hang with us. We have weight loss surgeon and psychologist here in the studio with us, plus a patient who opted for medical interventions to improve her health, how she is maintaining her results. We'll talk with her. There's also a new weight loss medication that has been approved by the FDA, so we're going to tell you about it. All of that is tomorrow, but today I want to introduce you to Pastor Brian Mann. When I first met Brian a couple years ago, he was a patient on a weight loss journey to improve his health. He shed 80 pounds all on his own. Take a look at his story. 58-year-old Brian Mann is prepping food for the week.
This is my go-to.
But 80 pounds ago, his choices were much different. Cabbage and carrots weren't on the menu.
A lot of processed foods, a lot of fried foods, cakes and cookies and donuts. When I would travel, donuts would be my go-to.
But a prostate cancer diagnosis changed all that.
Cancer is always a word that you don't want to hear.
But when he heard it more than a year ago, he was 316 pounds.
I realized that if I did a journal on my eating, I would be writing all day long. I just ate because I enjoyed eating.
And not just cancer, high blood pressure, diabetes, and the nutritionist at the University of Kansas Health System made him rethink what he was putting into his body, which now includes more fruits and vegetables and a new appreciation for water, less sugar, salt, and portion control.
It finally clicked. If you eat this, this is what you get. If you eat something else, then this is what you can have.
Brian is a married father of 3 and heads up the congregation at Bethel Church.
I think it really had to do with a culmination of how do you want to spend the rest of your life.
Since his diagnosis, the link between nutrition and cancer is clear.
Nutrition helps. Even if you haven't been diagnosed with cancer, maybe you have a family member that's been diagnosed. It's time to make changes.
Especially for the grandkids.
Nutrition is really important. If you have been diagnosed, give your body a fighting chance.
40, my friend. So the big question, you look great, by the way, but were you able to keep off the 80 pounds during the pandemic?
Absolutely not.
Darn it. All right, so tell me a little bit about that, and when did you start to feel the slide? What were the signs?
Well, before the pandemic hit, I had gained probably about 10 pounds, and I was struggling to keep it in that range. But once the pandemic hit, it was it just started sliding, and I started going back to some of my old eating habits. The pressures of life kicked in, and so I slowed down on my exercising. At first, I was still able to exercise, but I just didn't keep up with it. And as the pandemic deepened and all the trials of life came in, it just became overwhelming, and I went to food as comfort.
Well, you certainly are not the only one. I think a lot of us suffered from that. You're at home and you need a place to turn to. Brian, I want to ask you about something. I know you had told me when we spoke a couple of weeks ago that you were working as a chaplain during this time. Sadly, I know you said that you saw a lot of death during COVID. That must have had an effect. Talk to me a little bit about that.
It has been very difficult seeing, especially at the beginning of the pandemic. I saw patients that died alone, pastors that were loved by their congregation, and I found them in the hospital, in ICU, and no one there to visit them on a ventilator. And then when they died, there was no one there to mourn at the hospital, and so death was real. It made an impact, and it was devastating to see so many people alone and suffering through COVID-19 without the support of family.
Well, and here you are trying to fight your own battle of keeping weight off and staying healthy yourself, and then you'd suddenly find yourself thrown into the COVID world, really like a frontline worker all of a sudden. Brian, which foods do you think were responsible for the lion's share of your weight gain? What did you turn to? What was the downfall?
I would say carbs.
Yeah, right.
Carbs and sweets, and those are the things that really impact the most, I think, in health, especially both the sweets and the carbs are one and the same, really.
Yeah, they can make you feel pretty good. I know. Tara, I want to bring you in here to talk a little bit about that. You're a registered clinical dietitian here at the health system. First of all, just tell us a little bit about what you do and the patients you help out.
Yeah, so I work a few different clinics here at KU. I work for GI, specialize in the GI clinics. I also do just the general med clinics between a few different ones. So I handle a variety of cases: weight loss, diabetes, high blood pressure, cholesterol, food allergies, kind of a little bit of this and a little bit of that.
Sure, and I know a lot of those are some of the ailments that Brian was facing when he went into his health journey. So we're going to get back with him in just a moment. But I want to take you back. Go back, when we go back 30, 40 years ago, kind of the newsflash was America's fat. We eat just too much soda. We're overweight. We indulge in drive-through foods. Now this shift to these healthy options, menu changes. We have calorie counts on menus, which has forced me to take a second look, that's for sure. But every exercise and food app under the sun, every restaurant that, raw vegan restaurants, gluten-free restaurants.
Right.
Do you think this is a shift? I mean, what do you make of that? Do you think we have finally woken up to the fact that if we eat good foods, we actually might live longer and enjoy the life we do have? Or do you think this is something that's just here temporarily?
No, I think there is more of a shift to push the plant foods. They certainly have their health benefits, so I think that's why you're seeing a lot of that. There's a lot of scare with cancer diagnosis and just trying to eat those foods that protect us, and everybody's trying to get on the bandwagon and try to figure that out. Absolutely. And it's not changed. Too much drive-through, too much soda. It's not
still there.
Good in excess, and I like to point that out because all or nothing doesn't have to be that way. But yes, I think it's just continually we're trying to find it out, and if we can simplify it, even better, right?
Yeah, and it's also nice to know that really, what you do in your own home and what you pack for your lunch, for your kids, and you when you go to work is actually in your control. So it's kind of the one thing you might have some control over, not always. Just kind of a fun fact about you: you have an interesting background. You were a stage performer. I know you were in New York. You were in Branson. You, take care of your body. Your body was your instrument. Yes. You were a singer and dancer. So did that play a part in you wanting to kind of share? Did that when you did your career shift? Did that play a part in what you wanted to share with people about, you treat your body good, it'll give back to you?
Absolutely. But funny thing is I didn't necessarily eat well when I was so athletic. I kind of took for granted that what I was so active in kept me in shape, and so I didn't really think too much about it. But yes, I think certainly I learned over the years, especially with dance, that your body responds a little differently to cheeseburger and fries than, grilled chicken and salads.
Well, yeah,
so
and
you have to go out there and jump around for 20 minutes.
Well, and you're younger and more active. That helps.
Exactly.
And then we slow it down.
But yes.
So do you see patients like Brian? I really want to talk about, they're successful in the beginning, then they fall off the wagon.
Yes.
What do you see as far as that? And then I want to help him with some advice on how he can kind of get back on track.
Yeah, I do see that. I think, for one, a global pandemic certainly is nothing most of us have encountered in our lifetimes. So it's very understandable that we turn to comfort foods. All of us may turn to something different, but food is certainly a common choice. So just kind of helping patients recognize that that's okay is maybe one of the first steps in kind of getting us back on track. But yeah, I see that commonly, and life throws us curveballs, and just kind of trying to help people recognize, maybe figuring out the balance, being happy with small changes at a time so that you can sustain this lifestyle that you're working on versus an all or nothing. I do often see pretty restrictive diets that lead to deprivation, and that deprivation is what can sometimes send us over that deep end. But definitely a pandemic has changed a lot of patients, for sure.
For sure. That's nothing somebody like Brian saw coming. Here he is doing well, and then this hits, and you got to give someone like that a whole lot of grace, as we've been saying lately.
Absolutely. And in his field, and being so close to patients, and
well, he's a pastor, so he's got a lot of people relying on him.
Right.
To,
I can't imagine
during this time. So should someone like Brian just go back to what he was doing, what he knew before, or should he look at things a little bit differently? Writing things down, kind of going back through his journey, or should he just kind of go cold turkey, start something different? Where should someone like him start? He's proven he can do it.
Right. That definitely shows he's got the discipline and the motivation to kind of resume that. I think I'd want to chat with and seeing where he is. Is cold turkey right for him, or is like a weaning process best? The research certainly does support small changes at a time, and that is because we are looking to help patients discover a lifestyle, not just, hey, I'm going to go on a diet to get from point A to point B, but how do I sustain this way of life for the long haul? And in that, it's important to recognize that there's going to be days where you have a donut, or you go have pizza and wine with your friends, or a beer and broad at the Royals game, or whatever. We've got to learn to be able to sort of fit that in. And as a result, we have more long-term success with working on weight loss, diabetes control, et cetera. So I would want to know Brian a little more personally, but my overall general advice would be just make a couple changes. Start those vegetables up again once a day at dinner. Cut your treats in half, whatever it is to sort of, I talked to a patient yesterday. I said, get the fun size bar, and then we'll just work ourselves down, and she was just so relieved that I didn't just completely say, take it all away,
Right,
and it helps with the long-term success better.
I agree.
For sure.
Yeah, that's good.
Balance is hard, though.
It is hard.
It's really tough, but I think if we can kind of learn to accept that, we can be happier.
Balance.
For sure.
And small wins.
So easy to say.
I know, it is. I know. Okay, so Brian, we're going to talk a little bit more about your story, but I want you to take a look at this because we see a lot of these, the glycemic graphic and this index chart. So a lot of times people are kind of the eat this, not that mentality that we dive into, and so people are looking at these charts like, well, I thought a banana was good, or I thought it wasn't good, and am I supposed to eat this? I think we were like surprised that onions had such a high carb, and I eat those all the time. So how are people supposed to look at these different lists of food like this, and know kind of what's right for their body?
Well, I think that last point, what's right for their body, certainly what I talk about today is real general advice, because it's going to change for all of us. We're not a one-size-fits-all in medical conditions and everything, so that's really important to recognize from the get-go. Glycemic index, I'd rather help people see sort of the kind of how you might pair foods to control glycemic index. The problem with this is that we get in this fear of, oh gosh, I can't have carrots. Boy, they're pushing 50, or onions, like you said, which are so flavorful. That could be such a great punch to a bunch of veggies and really help people eat their veggies more as they find that so flavorful. Watermelon, I mean, my gosh, it's that time of year, right?
Yeah, it's
watermelon. So I think we have to be really cautious in that, because it will set up a stage of good versus bad. And when we're talking fruits and vegetables especially, we do not want to label them that. All of them have wonderful properties to offer us. It's just we may have to learn how to pair some of them, or kind of understand their portion size, especially if I'm dealing with diabetes or blood sugar control.
Okay, that makes sense.
But like watermelon, low-calorie food, if you're looking for weight loss, you can have a cup of watermelon for...
I'm not giving up my onions.
No way, me neither. So, I mean, there's different, this so simplified, but like really talking to patients about, I would rather them focus on, hey, what has more fiber? Eat your fruits and vegetables. Certainly we don't want to do a lot of snacks. Certainly we don't want to do, the more empty foods. Teaching patients a little more about nutrient dense versus calorie dense. Do I get whole grains, beans and rice, or do I get, pancakes and syrups and whatnot?
That fill you up immediately.
Right. You want to look for those filling foods. So and eating protein with these foods too certainly helps slow down. What we look at in glycemic index is how quickly the sugar is getting to your blood. So more or less trying to educate on, hey, have maybe I know this is maybe a little odd, but maybe a few nuts when you're having your watermelon. Have watermelon right after dinner so that it's kind of following proteins and fats and fibers so that it's a little slower.
Helps it break it down at a different level.
Yeah.
All right, so Dr. Hawkinson, you're not getting out of this conversation. Okay, so I have to ask you, so early in the pandemic, we had learned that carrying extra weight was not good if you also had COVID. So how does being overweight cause problems when battling disease in general?
Yeah, overweight or obesity is a major problem, all the way down to the molecular or cellular level, affecting your immune cells and their response to other cells in your body, such as your vascular system, your heart, your organs. And then you get up to more to the gross issues of the specific organs, like I mentioned, the heart, the lungs, all of the other blood vessels. So it's very important. So you're carrying extra weight. Certainly, if you have enough weight, you're having some restriction in your breathing, your lungs, you aren't able to gain enough breath. There's also concern for your vascularity, the blood flow. Is that getting to the organs? Is that getting to the farthest areas of your body, your fingertips, your toes, those things? So it is very important, and we do see that, and it does affect really your everyday life and other issues, not just COVID, but other infections, and then of course leads to other organ problems too.
So you do have to have those conversations with your patients then, I would imagine, as part of their wellness, progression.
Yeah, absolutely.
All right, so we want to bring Jill now into the conversation because I know our community, we want to hear from them. So let's jump in with our community questions this morning. Jill?
Well, thanks, Jess. Betty did have the question you just asked, so you helped us answer that one about the risk of being overweight and COVID. Marty wants to know, Dr. Hawkinson, in Springfield, it's been reported that 85% of the patients are on some kind of mechanical ventilation. Marty asks, what does that say about how sick they are? Because Marty had also read that ventilation wasn't the go-to therapy with COVID. What does that say?
Yeah, certainly early on in the pandemic, the thought from the best evidence that we had from China early on was that put these patients on the ventilator, put the tube down their throat, put them on the machine to help their breathing as soon as possible. As we got more information and more knowledge from our experience here in the United States, we found that let's wait a little bit. Let's not put them on the ventilator as soon as possible. Let's wait. Let's give them high flow oxygen, which is a lot of oxygen delivered through the nasal cannula or something of that manner. But let's wait and see, because we know that if patients get on the ventilator, it's very difficult to get them off. So basically, we use it now as a last resort if you are having trouble breathing or oxygenating your blood and your organs. So when you hear that you have 85% of people on mechanical ventilation, if it is the ventilator that they're actually talking about, that is pretty grave, because that is the last step that we're taking for you to try and get you to recover. So that is a very important fact to understand.
Monty says that 125 churchgoers or church camp cases in Texas were reported, and that 6 were breakthrough cases. And Monty wants to know, is this a cautionary tale for other summer camps this year? Should we be going to summer camp with Delta variant?
Yeah, I mean, I think the second point that was made, about 6 of those 125, and I didn't see the article, but I know that article is out there. 6 of those 125 cases were breakthroughs. So that is a very small proportion of the total amount of cases. So vaccination does work. Do we need to concern ourselves with Delta? Again, I think that as much as this is some issues about breakthrough and the disease, we also have to remember this is about behavior as well now, because we know the virus is prevalent. Delta is very prevalent. We know in Missouri and Kansas, it's about 90, 95 or more % of the sequences that they have been able to sequence. So we know that it's almost all of the virus that is out there in Missouri and Kansas right now. I think we need to continue then to understand what our risk is. If you're vaccinated, more than likely you're going to be safe from that severe disease, from hospitalization. But you can still also take those non-pharmaceutical interventions and do those things, such as distancing and masking, especially if you know you are going to be around a lot of people, where you have to assume not 100% of those people are vaccinated. And also if you're going to be around kids, because we know that those that are 12 and under really can't be vaccinated now. Hopefully that will change fairly quickly. In the next 4 to 6 weeks, we'll have more data and information saying that the vaccinations are safe and effective. But you can still continue, if you are around a lot of people, to do those masking and distancing measures as well.
Cindy is asking if we've had a death here at the hospital recently from COVID and if we knew how old the person was.
I believe our last death was July 4th, and I don't have any of the demographics right now on that, but we can certainly get that information.
Okay, and Barbara wanted to know, could you please talk about the availability of monoclonal antibody infusions and who would be a good candidate for that?
So right now, the monoclonal antibodies are very helpful in preventing hospitalization and death in those that are high risk of going to the hospital. So right now, it's only used in the outpatient setting. And we have our infusion center here at the University of Kansas Health System, which is down south. And we are offering that to people. We have, I think, given 375 doses of the monoclonal antibody since the EUA, the authorization was given for monoclonal antibody. I think we have 2 patients coming in today for it. We do actively screen our positive outpatients to see if they meet that criteria, and it is helpful still. We do keep track of the efficacy of that because we know as the variants come up, some of the monoclonal antibodies don't work as well as they did initially. In addition, we had actually one of our treatment task force meetings today, and we will be looking to use it as an inpatient when the emergency use authorization does come through for that, for the people that meet that criteria. So right now it is only for outpatients. It does really work and is very efficacious in preventing hospitalization and death. I think overall what we have seen from the patients that we've given it to is very similar to what they saw in the trials, and that it's about 3% of those patients ended up going to the hospital. That's about what we have had as well. So it is very efficacious, but it is certain people who meet certain criteria such as comorbidities, age, and again, the most important thing is that you've had symptoms probably for 7 days or less.
Okay, Jean says, yesterday I believe it was reported that 70% of the metro area was fully vaccinated. Latest figures from Johnson County show fully vaccinated at 49% and 37% for Jackson County. Can you clarify, what does all that mean?
Yeah, I think it's a matter of, number one, we have to look at the eligible population versus the total population. So some of those numbers could be different there. And then you're also looking at different counties. So you have to add the counties together to create those numbers. And depending on which resource you are using, some of those numbers will be a little bit different. I think that's the important thing to take from there. You have the local newspaper or local news outlets reporting one thing. Some of the Missouri or Kansas Health Department reporting another, maybe the New York Times or Washington Post reporting another as well, and then the CDC. But again, just understand what is the number that you're looking at. Is it the total population, which includes children all the way up to adults, or is it the eligible population, which would include everybody 12 and above? So I think that's where maybe some of the numbers get skewed or misconstrued, and just understand what exactly are you looking at based on that.
Well, so I'm going to follow up to Jean's question. So
Yeah.
Do we know what is safe to say that our vaccination rate is?
Yeah, I would have to take a look back and see exactly what that is, and we can try to get that here for you real quick.
Okay, couple of questions, and then I'm going to shoot it back to Jess. Diane wants to know, could you please tell us the amount of patients that we had in our count that are vaccinated versus unvaccinated?
Mm-hmm. We don't have that information today. We had it yesterday. As we have more patients, it's a little bit more difficult to go through and get that information. From yesterday's information, what I can tell you is that our total population of inpatients in the hospital, 80% of those were not vaccinated. So we had, it was about 81% were not vaccinated. So the vast majority of people in here with symptomatic disease were not vaccinated. And we will try to continue to keep up with those numbers. It's just as we get more and more patients, it's a little bit difficult sometimes to go through all of the charts looking at vaccination status and comorbidities. But the majority of those patients that were vaccinated and here in the hospital did have significant comorbidities as well.
Okay, I'm going to kind of add to Isaac's question. Good question, too. He's wanting to know, are we going to suspend surgery soon in order to free up capacity? I think the answer for us is a clear, hard no. But what about in Springfield? Are they doing that? What does your colleague down there say?
You know, I think you're correct. Here, everything is on the table so that we can do the best thing for our patients overall. But right now, there is no talk of suspending surgeries. We know that we did that initially, and that was also to help get in our protocols and our safety measures for the people that are undergoing surgery. But right now, there is no plan to stop doing surgeries, either elective or non-urgent at this point in time. I'm not sure exactly what's going on in Springfield. I'll try to reconnect with one of my colleagues and see kind of what they're doing based on their capacity issues and routine medical care or routine surgeries, things of that nature.
Okay, and Janet wants to know, with so many people at the grocery store without masks, and now we know Delta is here, shouldn't we go back to wearing masks?
Yeah, I mean, right now, there still is no change in guidance from the CDC about being fully vaccinated and wearing masks. I think it is up to you as an individual to see what is your risk tolerance. You know, certainly when I still go into the grocery store, there is a sign that says masks are recommended and distancing as well. I know that I continue to wear a mask. So, you know, there probably will be more information or more guidance coming out. Right now, there is no further guidance that if you're fully vaccinated, you can still do those things without masks. Just understand your own risk tolerance. Understand that anywhere you go in public, the likelihood that 100% of that population is vaccinated is extremely low. So if you still feel more comfortable wearing a mask in the grocery store, that's certainly within your purview, and I would encourage you to do it.
And as I sign off, and this is the final question, Jess, and then you take it from here, Amy wants to know, is it okay to go to Branson and vacation?
You know, again, risk tolerance. I think you have to understand what you're doing. I know there's a lot of outdoor things to do in Branson. Those are possibly more safe than the indoor issues. I don't know all the places in Branson as far as airflow and things of that nature. Are they still requiring or mandating masks? I don't know. So I think, again, you have to understand what are you going to be doing there in Branson? What are those activities? Again, indoor is probably going to be more risky than outdoor. If you do those things, try to distance as much as possible. Try to continue to wear your mask as well, and kind of just understand that the situation you're going to be in. And of course, get vaccinated if you're not vaccinated yet.
The answer to everything. Jill, thank you. I do have a few quick community questions actually for all of our panel today. I'll start with Dr. Hawkinson, sticking with COVID. David just wants to know, how exactly does the vaccine work? This might be helpful for folks who might still be on the fence with the vaccine. What do you want them to know?
You know, so I think if we're talking about either the mRNA vaccine or the viral vector vaccines, basically you get the injection in your arm. Locally in your arm, you have the uptake of either the virus or that mRNA at those cells in the arm. But a majority of those things are going to be taken up by other cells, which then travel to the lymph node in your armpit, in the axillary area. And it's in those lymph nodes where you start to create that immune reaction. And you have activation of B cells to create antibodies, and you have activation of T cells to also help do more immune communication with other cells, but also present some of the spike protein that is created to other immune cells, as well as just develop that full T cell response to kill any virus-infected cells if you do get infected. So after that is said and done, especially after you're fully vaccinated, which is 2 weeks after the single dose of Johnson & Johnson or 2 weeks after that second dose of the mRNA vaccines, you will have a full repertoire of B cells to create antibodies to different areas on the spike protein, but also the T cells that also recognize different areas on the spike protein. So that if you do get infected, and your cells start presenting pieces of that virus, they will act on those areas, the T cells and the antibodies, to help create your immune response and get you better much more quickly and a higher chance of getting better than if you did not have the vaccine. So hopefully that was a clear, concise.
Very much so. Thank you for that. Okay, Tara, Steve wants to know, what is the number one thing to either take away from your diet or add to your diet? Just if you were in a starting point to better nutrition, better health, certainly coming out of this pandemic.
Well, first of all, nice question, because you picked one or two things to start on, and that's absolute key. I would say sugary beverages, don't make them a primary. We see a lot of patients have a lot of quick results once they just reduce sugary beverages. And then to add, I would say where's that fiber? Could we add a fruit? Could we add a vegetable? Just work on increasing fruits and vegetables. That was kind of plural, but one group of things.
One food group. Okay, that's good. I mean, a lot of it seems like things we would already know, but it's good to be reminded. I gave up Coke, and I told myself I never want to give up. People would say, just cut Coke out of your diet. I go, I don't want to cut it out of my diet. I love it. It's my best friend. But the minute I did, I never thought in my wildest dreams that I would not really be thinking about it daily, and here I am 4 months later. Not. Are you proud of me or what?
I am very proud, and I would just add to that, make your primary fluid water. You know, so sometimes, depending on your health condition, Coke, an occasional one might be something you dabble in here and there, but it is overdone, so we need to reduce.
Okay,
for sure.
I will dabble. Okay, I don't know if you know the answer to this, but also Steve wanted to know, I don't know if you know what herbs are best for healthy blood flow or foods that might be good for healthy blood flow. I don't know if that's something you might know. I know you're not an herbologist, but is that a word? I don't even know if that's a word, but okay. So.
I like it. Herbs and spices are certainly always being researched, have definite benefits, same as fruits and vegetables, so the more the merrier. I think we have to be careful with some of them. Talk with your doctor on any kind of medication contradictions they might have. There is research on some that help sort of, dilate those blood vessels, making them, open up a little more. Ginseng, ginkgo biloba, that's a tough one to say. But again, I would caution you, please talk to your doctor first, because there certainly are some medical conditions or medications you may be on that we would want to discuss those things.
Difference between the herbal supplements and fresh herbs, right?
And it's so concentrated, exactly.
Sure.
So I mean, if you're using that to cook and add to your fruits and your vegetables, your meats, whatever, certainly go ahead and do that. But in those concentrated pill forms or anything like that,
you still want to consult your doctor with that?
Yes, absolutely.
Okay, some people might not know that. They just start reaching, filling up their cart with all sorts of supplements, thinking they're doing a body good, and it may be hurting.
Start with some fresh herbs and spices, and then chat with your doctor.
Okay, then rack it up. Okay, sounds good. Okay, so Sarah, Brian says, how did you get started losing 80 pounds? She says, that sounds daunting. I'm stuck trying to figure out a starting point. What advice would you have for me?
Start.
Just start.
I love it.
Just start. And it was very difficult at the beginning. I would get on the elliptical, and it would almost kill me to go 10 minutes on an elliptical machine. And within 3-4 weeks, I was up to 50 minutes, and I could have gone longer. I just didn't have the time. But it's basically starting. And whether you have weight loss surgery or you're doing it on your own, the key is you just have to battle with self-control. There are some people that maybe their metabolism is faster, or they're able to burn the calories. That's not me, but you have to weigh out, how much can I eat and add the exercise. But if you try to go just by a diet alone, I don't think that it's going to work. If you try to do it just by exercise, it's not going to work. It takes control, self-control, or I should say Holy Ghost control, because I believe that God really has helped me in that. And I'm back on track. I'm so happy to hear the nutritionist say she would have to talk to me, because you can always put out a plan, But unless you know the person, I think you really need to know the person. I've taken things from the journey of losing the 80 pounds, and now I have some information that I can move forward with because with my walking, now I'm trying to break it up into 30 minutes in the morning, 30 minutes in the evening. Whereas before I would walk up to 2 hours in the morning and then come back with an hour in the evening, and over a long span of time, that's not realistic. So I have to, find out about myself, what works, and then recognize that it's a battle. Am I going to eat to live or live to eat? And I choose to not make food my go-to, but a way of just making life prosperous and healthy, and so that's just start.
Really
Start
well
by
said.
with a
Very
little
well said.
little thing.
Just
Walking.
start. Yeah, I love that. I just have to ask you this real quick, though, Tara. Is that 80-20 mindset really a real thing? Brian mentioned exercise. We hear a lot about it's all about the food. You can't outrun your fork. So is it 80% diet, 20% exercise, somewhere in that? Is that a real thing?
I think that's just an idea to get people to motivate.
Okay.
That nutrition is a huge part, because we're not all meant to be in the gym or running marathons or whatever it is. You do have to find what you like, what you're going to show up for. I think it's more of a point, right? That I may walk for 30 minutes and I could burn a couple hundred calories, but boy, I sure can eat 200 calories pretty quickly. So in the mathematical point of things, nutrition has a bigger weight. But Brian, we are all different, absolutely, and the journey is different for everybody, and kind of figuring out who you are, what's realistic for you, and is health your priority? We're not all meant to be the same, right? The same size, the same anything. So making health your priority certainly is the end goal that I want for my patients too.
Brian, I want to get to some final thoughts. You just shared such a great message with us. But just as you start on this journey, and I know now you've proved to yourself you can lose 80 pounds, so now you know you can do it. And any just last parting words that you can share with our viewers who are right along there with you?
I think having a support system helps. I know my daughter, she is really attacked her weight, and so she's making all the right choices. She's getting up early, going to the gym. She asked me, "Dad, you going to the gym with me?" I said, "Nope." I'm not going to the gym. I'm going to walk. And so, I've been consistent in my walking, and last night she went out walking with me, and I asked her, and so she goes with me more than I go with her. But you just need to start. It's difficult at the beginning, but your body, it recuperates. Your body, it has the ability to make those changes, and you start to see very quickly that what you thought was difficult and what was difficult actually becomes easier and easier, and then you begin to enjoy it. Now, I'm not one that's going to ever say, that I just, it just gives me such a thrill, but the thrill comes from seeing the positive feeling that I have from the weight loss, and not to be struggling so much just to move around. So it's a blessing, and I think that if you just start, keep going, it doesn't matter how small or how many minutes, just start, and your body will thank you for it, and it will reward you.
We're going to be talking about the power of walking, Brian, so I'm glad you brought that up. We're going to talk about that later on in the week. And yes, no one is thrilled about having to work out, but we are going to check back in with you. No pressure. We're going to have you back on here, hopefully throughout your weight journey, and we'll see how you're doing, because you've inspired a lot of us today, and we really, really appreciate you. Thank you, Brian. And Tara, just what do you want us all to know as we kind of set out, not just to lose weight. This is not about losing weight. It's about if you need to lose weight to maintain really good health, then certainly so. But just to live a healthier lifestyle, what are some tips that we can head out today? What are some specific things we can do?
Specific tips. Well, I'm with Brian. Start. Same with nutrition as you would exercise. What can you do today? Can you have a piece of fruit between lunch and dinner, or add one to your breakfast? What is it that you can start with today? We all know fruits and vegetables. We say it all the time, just working on increasing those. I would say one of the biggest things I see in both health and weight is that the sugary beverages and the traditional fast food. I mean, you could certainly go and find your salad at fast food, but it's not really why we go to those places, right? So,
right.
I mean, that's not what they're good for. But watching the highly processed foods, the junk foods, the treats, what is the focus on your diet? I really encourage you to be kind to yourself. Be realistic. Small goals at a time. Like I said, like Brian and I keep saying, start somewhere. Even and push yourself. Is it just 10 minutes? 10 minutes walk today, once a week until you do 10 minutes twice, 10 minutes 3 times. And approach the same thing as you do food. This is not pass fail, right? Mm-hmm. It's not pass fail. 80% is okay. B average is all right.
Average is good.
Yeah.
When it comes to certain things, average. When it comes to our weight, it's just perfect.
Think that's the biggest problem most people have, is that we set ourselves up to be 100% perfect, and that's just not realistic, right?
Best version of you. Be the best version of you.
Yeah, and don't try to be somebody else. Do this for you. Be realistic with yourself. Be kind on the journey. I'm not sure that was specific. Eat more fruits and vegetables. Drink water. Get up and move.
Things that we've heard all along, but thanks for the reminder. And it's good to have you on today. We appreciate you.
It's not overly, exciting. Have a big spend to it, but
yeah, you're like, there's nothing new, but it's good to know. All right, so Dr. Hawkinson, final thoughts from you today.
Yeah, continue to get vaccinated. We know Delta variant is out there. Have a little bit of some information about the vaccination. And again, I think it depends really on what source you're looking at. A lot of the sources are fairly similar, but they're not always on exactly the same. So in the Washington Post, for example, in Kansas, for fully vaccinated of the full population of Kansas, it's 42%. But 49% who have reached or received 1 dose. Again, that's for Kansas as a whole. But then if you go down to the county level, for Johnson County, it is 56% of all ages that are fully vaccinated. So not only county level and state level, but you also have to understand what population are you looking at. So that's for all ages. For people that are 18 and over, it is 65% of the population that is fully vaccinated in Johnson County. And then for people that are 65 and over, it is 90 or 91% fully vaccinated. So when you do hear some of these numbers, just understand which source you're taking from, and understand, is it the full state or is it down to the county level? In addition to that, understand what ages you're talking about. Are we talking about the full population, 0 to 90 plus or 100? Or is it the eligible population, 12 years old and older? Or, for instance, here we have the designation of 18 and over. So just understand that. Is it the state? Is it the county level? And then what are the ages they're talking about?
Good info today. Thanks.
Yeah.
Mm-hmm. All right, so my final thoughts today are for a special group of volunteers who are finally back with us after 16 months. We want to show you Sheila Bailey. She is one of our Rock a Baby program volunteers who give parents in the neonatal ICU a break. I was one of those parents, so those people are doing God's work. So volunteers, they commit to rocking these little ones for 4 hours. The health system relies on volunteer power with nearly 200 essential workers, from pet therapy to those baby rockers. So welcome back, volunteers. We love you. We appreciate you, especially those rockers. Have a great day. And remember, we are going to be talking about medical interventions to lose weight and really help change your life. You're going to also hear from one woman who did it just like that, big time. So we'll see you then. Have a great one.